Today we are going to discuss about the salivary glands, and in that salivary glands we are going to discuss about the parotid gland. In the parotid gland we are going to discuss about the contents like introduction, parotid gland, boundaries, structures passing through the parotid gland, whatever the relations of the parotid gland, nerve supply, blood supply, applied anatomy, and whatever the textbook you have referred. If you could mention in your book or your answer sheet, it would be fetching marks. Okay, coming to the introduction part, I just want to give you a suggestion that if you present in this way while giving an answer to any essay question, it will give a good impression on your paper. Okay, use different color pens, write blue and black pens, so and highlight your whatever the headings are there, and it will be looking attractive, and also it gives a positive impression on your paper, so it would help you to gain good marks. Okay, now first we are going to discuss about the introduction. In the introduction you will write about the salivary glands. Salivary glands are the major salivary glands or minor salivary glands. These are included, these are kind of organs which are included in the alimentary system, and there are about three pairs. First one is the major salivary glands and the second one is minor salivary glands, and in that parotid, submandibular and sublingual are included under major, and in the minor salivary glands labial, lingual, buccal and palatine, these are named according to their location. Okay, and you can also present in this way major and minor. We can divide like this, and you can box it out to major and minor, and all these glands are included under the major, and these kind of glands are included under minor. You can list out like this or present in this way. This will fetch you good marks. And the next thing is parotid gland, and it is a major salivary glands, and it secretes saliva, and it's a type of exocrine gland. The reason why we call it as exocrine, because it is having ducts. Okay, and it secretes kind of a saliva which is very serous type, right? Watery type. Serous means somewhat watery kind of saliva, and it is also tubular type of acini will be present, and it's situated just parallel to the ear, and the shape is inverted pyramid kind of shape, and it is of 20 to 25 grams of weight. Now we are going to discuss about the boundaries. And the boundaries: superiorly, anteriorly, posteriorly and medially. These are the three boundaries, four boundaries which we are going to discuss. And the superiorly, superiorly we see a structure called as external acoustic meatus, and anteriorly we see ramus of the mandible, posterior border of the ramus of the mandible, and posteriorly we see mastoid process, and medially we see styloid process. So these are the whatever the boundaries of parotid gland. And next we are going to discuss about the structures which are piercing the parotid gland. As I discussed earlier that it is of inverted pyramid in shape, and these are the structures which are piercing the parotid gland. This circle which I have encircled is drawn here is nothing but external acoustic meatus. Okay, superior, the border superiorly which is present is external acoustic meatus, and beside that we see three structures I have drawn. Okay, three structures I have drawn here. See, whatever the colors you see, the colors here are one color is as one thing you should remember while presenting your paper is if it is anatomy. If you are going to write about the anatomy or anatomy paper, you should be very careful while drawing the pictures, because each structure has a specific color. So carry your color pencils, and specific structure has specific color pencils. So for that, see, if it is in red color, it means it is an artery. If it is in blue color, it means it is vein. And I have drawn with an black color, because yellow color does not appear good in this paper with the pen, right? So in the camera, so I have drawn with a black color, but you use yellow color while you're drawing your nerves. Okay, these are the three structures you have to study entirely. What are the arteries or veins or nerves which are passing through the parotid gland. I'm again repeating. See, arteries means red color, veins means blue color, and yellow means nerves. Okay, these are the three structures. Arteries, veins and nerves are the three structures which are passing through the parotid gland. Okay, see, first thing is artery which is passing at the superficial temporal artery, and vein is passing a superficial temporal vein, and this nerve is auriculotemporal nerve. Okay, auriculotemporal nerve and this facial nerve. After that, I just want to help you to remember, because anatomy is very difficult. To all the structures which are passing through the parotid gland is also different. Just imagine this is a structure which are present near the ear on the left side or the right side. So when you if you think this is an ear, right? Here on the upper side, here a bone which is present at the forehead area, forehead, beside the forehead on the left side, if you see that bone is called as called as temporal bone. So I think you already know that. So according to that temporal bone only, the names will be given to the arteries and nerves. Okay, so auricle means ear, so ear at the temporal bone, near that it is present, so it is called as auriculotemporal nerve. Okay, then superficial temporal artery, so it is related to the temporal bone, so it is also superficial temporal vein. So artery is superficial temporal artery and superficial temporal vein and auriculotemporal nerve. These are the kind of arteries, veins and nerves which are passing in the superior part. And here the facial nerve is present, and the facial nerve will be divided into various branches after entering into the parotid gland. Okay, here it is going to divide into 5 parts. Here see, when you in the temporal bone part area, that is called as temporal branch of the facial nerve. Okay, temporal branch of the facial nerve. And below the temporal bone, here the cheek part arises, and the cheek part will be having a kind of bone called as zygomatic bone. So that bone is called as, so that type of nerve which is emerging from the facial nerve is called as zygomatic branch of the facial nerve. Then again we are having lower buccal nerve. Okay, here the buccal part will be having, or the lip area where below this zygomatic area is called as lower buccal branch. And also below that we have a mandible here, so there also one nerve will be emerging from the facial nerve, that is called as marginal mandibular facial nerve. And from there we are having cervical branch of the facial nerve. So these are the 5 different branches, 1 2 3 4 5 different branches emerging from the facial nerve. After entering into the parotid gland, it will be divided into 5 branches here. Then again we are having anterior division of the retromandibular vein and posterior division of the retromandibular vein. These are the, as it is in blue color, we will mention with the we have to remember that blue color means it is a vein. So posterior division of the retromandibular vein and anterior division of the retromandibular vein. I just want to tell you that here facial nerve and also facial arteries and veins are present. Okay, facial artery and facial vein are also present on this side. Again this facial vein, after entering into the this parotid gland, it will be divided into anterior and posterior retromandibular vein. Okay, then external carotid artery. External carotid artery is the main artery which is passing into which is emerging or related to this, which is piercing this parotid gland. And the nerve supply, coming to the nerve supply is having a secretory motor pathway, sympathetic pathway and sensory pathway. There are 3 pathways here: parasympathetic, sympathetic and sensory pathways are present. So parasympathetic pathway is very important for the discussion. Even it can give given parasympathetic pathway of the parotid gland as a 4 marks question. So you need to draw a diagram here. See, this is the brainstem part having 2 swellings, right? This is first one thing is pons, and the second thing is medulla oblongata. In the pons, from nucleus will be present, and that nucleus is called as inferior salivary nucleus, and it will be emerging out as the auriculotemporal nerve. Then it will be dividing into tympanic nerve. Okay, see, I have given an yellow color. You should draw this entire thing in the yellow color because it is all nerve supply, right? Yellow, tympanic nerve, and then it will be dividing into a kind of branches here, various number of branches or a network. It forms as a network here, and this network is called as tympanic plexus. From that, lesser petrosal nerve will be arising, and that it will be given into otic ganglion here. It forms into a ganglion, or there will be a relay of a ganglion here, and this ganglion name is called as otic ganglion. Okay, otic ganglion, and from there postsynaptic or the post ganglionic fibers will be arising here. Those are called as auriculotemporal nerves. Okay, auriculotemporal nerve, after that post ganglionic fibers, and they will arise and divide into parotid branches, which will be giving rise to or giving nerve supply to this parotid gland thing. Okay, then you can also mention this in the kind of flow charts. See, presenting your paper in the form of a flow charts will fetch you good marks. So I just want you remember that if you draw, or also if you remember, you prepare your notes in this way, you can remember at once, and just you will go through this flow chart once, and you will write it as a paragraph format or whatever the points format. Just you remember this and put it on your paper first. Okay, remember this, whatever this is there, just in the form of a flow chart, right? Inferior salivary nucleus, from there it is going. So the same we have discussed here: inferior salivary nucleus, then preganglionic fibers, then glossopharyngeal nerve, then tympanic nerves and lesser petrosal nerve, and otic ganglion. From there auriculotemporal, parotid branch, and parotid gland. So this, it is a kind of a flow chart presentation where we see in the textbook also, right? But the same if you present, you will get it will be helpful for you to gain the good marks. And there is also sympathetic and sensory supply. Sensory supply is by the greater auricular nerve and also auriculotemporal nerve. The next thing is blood supply. Blood supply, we have drawn the diagram, right? I have shown you the diagram, which is the diagram about, I have shown you the diagram already. So that is about blood supply, external carotid artery and superficial temporal artery, and the other thing is maxillary artery. These are the three arteries which are supplying the parotid gland. And next is venous. What is the venous supply? We have discussed the arterial supply. Now we are going to discuss about the venous, just mentioning them. Okay, retromandibular vein, we have drawn this. Superficial temporal artery also we have drawn in that diagram. External carotid artery also we have drawn in that diagram. Okay, and these are the I'm just showing that picture again. See to just memorize that structures carefully. External carotid artery, which is drawn in the red color here, which is piercing. This is very important artery for related to the face. Okay, so that on the head and neck area, external carotid artery is very important. So whatever the structures which are present above our neck area are completely related to the external carotid artery or the carotid artery branches. And then we are discussing about the vein also. We retromandibular vein, I have told that, and also auriculotemporal, superficial temporal artery is also present. These are the arteries and veins which are going to supply the parotid gland. And now at the last end part, it is very important to mention applied anatomy. Okay, applied anatomy regarding the parotid gland is that Frey, I just want to tell you that at the end, at least in the UG stage, if you mention just the names of the diseases and you write at least 2-3 lines about that, it will be very useful for you, because we tend to remember until here, we study until here and we'll forget about this part. But this part is the main part for you in the later stages, so that it is very mandatory that you should know about the diseases also. This is applied anatomy part, is the disease part of that whatever the normal structure, and this is the abnormal part. You should know this and you should mention within this in your paper, because as a student I also face that until here we'll study and we'll get exhausted until here remembering all these names, but it is also after that you just give a break and you just study. This is a separate part, and also you just remember those names and put it on the paper. So okay, Frey syndrome is the first thing, and Frey syndrome is nothing but injury to your nerve supply, to that whatever the nerves are passing through the parotid gland, right? Parotid gland nerves, the auriculotemporal nerve or the tympanic nerve, whatever the nerves are passing through this facial nerve or any kind of nerve which is piercing or emerging through the parotid gland. If any cut injury occurs here, then we'll face a different kind of disease related to this kind of parotid gland, and it is called as Frey syndrome. That means injury to the nerve supply. And also parotitis means, itis means inflammation, so inflammation of the parotid gland, which might be due to the viral infection, and this is a condition is called as mumps. Okay, already I think you will be already familiar with this. And also we can mention about the parotid tumors here. Okay, parotid tumors, some kind of tumors will be present with related to the parotid gland. And for you as a UG student, you can write up until here and present your paper.